patient is in respiratory failure, providing them with supplemental oxygen alone just won't cut it. You'll need to ventilate your patient with a bag valve mask. Signs that your patient is in respiratory failure include altered mental status, cyanosis, shallow respirations, and significantly diminished or elevated respiratory rate. The first step is to manually open the patient's airway, utilizing the head tilt chin lift or jaw thrust maneuver. Remember, if trauma to the head, neck, or spine cannot be ruled out, then the jaw thrust maneuver should be implemented. Now that you have opened your patient's airway, it is time to secure it with an airway adjunct, which we discussed in detail in a previous lesson. Apply the BVM mask to the patient's face using the CE grip. Your thumb and index fingers should be wrapped around the mask while applying firm downward pressure. At the same time, your other 3 fingers should be hooked under the patient's jaw, pulling it up into the mask. Compress the bag only until you see the patient's chest rise. The average tidal volume for an adult is approximately 500 milliliters, while the average adult BVM is capable of delivering 1,500 milliliters or more, over 3 times the necessary volume. This is why we only compress the BVM until we see the patient's chest rise. The most common complication associated with overventilating your patient is gastric distension, because the excess air that cannot fit into the lungs will travel down the esophagus and into the patient's stomach. This can not only lead to vomiting, which increases the patient's risk of aspiration, but also physically makes it harder to ventilate the patient. When the stomach is filled with air, it compromises the diaphragm's ability to expand during inhalation. This, in turn, means that the lungs won't have enough room to expand enough to accommodate a healthy tidal volume. Overventilating can also injure the patient's lungs themselves. This is called barotrauma, and it is caused by a rapid change in pressure in an enclosed body cavity. Pediatric patients are particularly vulnerable to barotrauma due to their smaller, still developing lungs. It is for this reason that the pop-off valve was invented. Ventilating the patient too quickly also causes gastric distension, which, as we've established, leads to further ventilatory compromise. If that wasn't bad enough, hyperventilating can also potentially reduce the patient's cardiac output and cause your patient to go into shock. Historically, EMS providers have a tendency of hyperventilating their patients. An adult patient should be ventilated once every 5 to 6 seconds. A pediatric patient should be ventilated once every 3 seconds. Each ventilation, regardless of age, should be delivered over a period of 1 second. If you are concerned about a patient with a low pulse oximetry reading, hyperventilation is never the answer. The best way to help your hypoxic patient is to ventilate with the correct rate and volume and attach high-flow supplemental oxygen to the BVM as soon as possible. Don't squeeze the bag harder, giving it more volume. Don't squeeze the bag faster, hyperventilating your patient. This will not solve the issue. Supplemental high-flow oxygen and utilization of a PEEP valve are the only 2 ways to safely increase your patient's oxygenation. We will talk more about PEEP and its importance in our CPAP lesson. Remember, it takes at least 45 seconds for a pulse ox to show any changes in the patient's oxygen saturation. Finally, it is important to keep in mind that 2-rescuer BVM administration is the gold standard for ventilation and should be utilized whenever possible. Having 2 rescuers operate the BVM allows one rescuer to solely focus on achieving an effective mask-face seal, while the other can focus on compressing the bag at the appropriate rate and delivering adequate volume. The 2-rescuer method also allows for more flexibility in terms of rescuer positioning in relation to the patient. Your technique for securing the mask to the patient's face will differ when performing BVM ventilation with 2 rescuers. You can utilize the double CE grip or the 2 thumbs technique, which is especially beneficial for trauma patients who require a jaw thrust maneuver to maintain a patent airway. A manometer measures inspiratory pressure. It tells you how much pressure is being created in the patient's airway with each ventilation. If your BVM has a manometer, be sure to utilize it. The ideal delivery range is between 10 to 20 centimeters of water. Most manometers are color-coded to help you remember the safe and effective pressure range. Dentures. If your patient wears dentures and they are securely attached, it is ideal to leave them in place. Dentures can help fill out the face and facilitate a better mask seal. However, if the dentures become loose, they must be removed, as they have now become a potential airway obstruction. If you remove the dentures, be careful not to lose them. Dentures are expensive and difficult to replace.